Jeff, I sit here and I listen to your long dissertations of how healthcare is supposed to be. It's complicated. Can you please just give us a simple answer?
Jay, you want a simple answer to a complex question? All right, I got one for you. Here's how we solve the healthcare problem tomorrow. You take a hospital like Johns Hopkins, and what you do is this. You allow Johns Hopkins to accept medical premiums that you would be paying to an insurance company. Let Hopkins collect it directly. What we need to do is totally eliminate the Blue Cross and Blue Shield, Kaiser Permanentes, and any insurance underwriter out of the equation. Here's what I'm trying to tell you, Jay. You got a doctor and you got a patient. You try to bring them two together. No middlemen in the equation, which is the Blue Cross Blue Shield, which is your hospital plans. What you want to do is allow Hopkins to collect, let's say, a premium of $300 a month. Let them directly get the premium. What Hopkins could do immediately is to at least 100% cover all expenses for health care. I'll tell you the significance of that, Jay. That means when you go get your hospital needs taken care of, you have an 80% that your insurance company will pay. If Hopkins didn't have to deal with the insurance company and became your insurer, they could cover you 100% and eliminate that 20% gap of insurance. Now, what's the significance of that, Jay? If you had cancer and you made $100,000 a year, the 20% that the insurance company wouldn't pay would bankrupt you. It would bank any American. And the hospital would have to do its best to take your house, your car, your estate, whatever it does, it will take to get its other 20%. Hopkins could compete directly with Blue Cross and Blue Shield by offering 100% coverage versus the 80-20 that's offered to Blue Cross and Blue Shield or any other insurance underwriter. Now, the next part of this equation is this. When you have Johns Hopkins, which is located, let's say, with a million people population group around their hospitals and all their satellite hospitals that they have throughout Harford and Baltimore County, they could be getting a total of about $300 million a month collected premiums that would be used for the care of the patients, pay its doctors, pay its overhead. $300 million guaranteed money that they would be getting per month, which would equate to $3.6 billion a year without dealing with another insurance company. Has you may say to me, Jay, but what about all those people that work at Hopkins? What are they going to do? Well, here's what they do. Hopkins has to actually allocate an expense, a building or a wing of the hospital that's just made to collect the insurance premiums or the insurance payments from insurance companies, who the less they pay, the more profits they make. So what happens is, if we could take all those workers and make them into nursing staff, hospital staff, or eventually hospital builders, that would be a better employment for Johns Hopkins than it is than hiring a wing full of bill collectors. Now that's the short answer on how you at least spark the change of the medical system. And when anybody tells you, Jay, to think outside the box, you tell that person that they're an asshole. Because the answers are inside the box. They always will be. And remember, the simplest answers are usually the right answers. Did I answer your question today, Jay?
Yes, sir. Once again, the answer man.
Boom!